Hello and welcome to For Your Health. I'm Mark Crosby. Thank you for joining us. This program, For Your Health, looks at various health issues, health concerns, and helps you to, stay healthy. Joining me today, as in programs past, is Caitlin Kirby. She is a public health nurse in the city of Quincy. So Caitlin, welcome back.
Thank you for having me, as always.
Always a pleasure to have you. Always a lot of information that you share, not only with the folks of Quincy, but other towns and cities in Massachusetts and beyond.
Yes, and I always try to, whenever I do a different topic, I get all my information from either like the CDC, the State Health Department, and then today, this episode is going to be from the National Institute of Occupational Safety and Health. So it is very universal information. So it covers many different states, and which is great.
That is great. And I think I might have suggested this topic. I'm an outdoors person. You are an outdoors person as well. You like to hike. I like to hike. I like to kayak. Today's topic is about poisonous plants. So certainly you and I come across poisonous plants, either hiking or kayaking, but simply gardening. You can come across these as well. So thought it would make a great topic.
Yes, and it's all about what symptoms you can get from them, and then like how to identify, and then how to protect yourself. So definitely important information, and that way if people do notice like a rash from potentially a plant, they know kind of how to follow up and seek help for it.
Very good. So let's start with an outline for folks and for me, of course, too. So what makes a plant poisonous? Symptoms of skin contact, plant identification, and we're talking about poison ivy, poison oak, and poison sumac specifically. Treatment, how to protect yourself, and naturally we'll end with resources. So folks, although a half hour is a good time frame to cover this topic, folks can always find more information at the sites we provide.
Absolutely, yes.
So what makes a plant poisonous?
Yeah, so you had mentioned the most common poisonous plants native to the United States. We have our poison ivy, poison oak, and poison sumac. So all three of these plants, they produce a chemical known as urushiol, otherwise known as sap oil. And basically when a person comes into contact with the sap oil, they can have an allergic reaction, can be very itchy, and it can even be painful. And it can easily spread to different areas of your body. So you want to make sure you're looking out for this. And it is kind of interesting because not all people will have reactions.
Yeah, that's funny because I a friend or a relative, I can't recall, had plenty of poison ivy in his backyard, touched it and never got a reaction, which was a surprise to me, but now you're telling me that that's possible.
Yeah, so it's not everybody's going to have a reaction, but for those who do, and knock on wood, I've had it when I was younger and it was very painful. So it's definitely something you want to try to avoid, even if you've never had it before, you want to make sure you're avoiding it because you don't really want to test it to see if you're allergic or not.
Of course not. Let's look at some of the common signs and symptoms.
Yeah, so common signs and symptoms associated with the sap oil exposure. So we would have a red rash within a few days of contact. It would appear as bumps, red patches, or streaking, and it's often weeping blisters. And it's very important to note that the fluid that comes from these blisters will not cause the blisters to spread to you or others.
That's interesting.
Yeah.
See, I thought that was not the case.
Yeah, so it doesn't, that the fluid won't really make it, but if you think of it like if I have sap oil right here and then I'm scratching, that can still spread it.
Okay.
And hopefully, like, once it is like a red weeping rash, you're more likely to go get treatment rather, like, you're not going to sit there and scratch at because it's an open wound.
Right.
Um,
And you're probably, if you're probably creating a environment for other infections.
Yeah,
Exactly. Right.
because anytime we always say in all our programs, like the importance of like hand washing, just how frequently we touch different objects and germs that stay on your hands. So with like a rash like this, any rash is opening your body to more infection. So you really want to make sure you're not scratching it because these sites can swell and they can be extremely itchy.
Right, so swelling and itching is part of that as well, the signs and symptoms. Let's look at plant identification. All these plants that we had mentioned are green.
I broke it down for the three separate, the poison ivy, poison oak, and poison sumac. So there is a saying, leaves of three, let it be. And that's pretty helpful with identifying poison ivy and oak. But the poison sumac, they normally have leaves in clusters of 7 to 13. So the leaves at 3, let it be. It really only works for the ivy and the oak. Also important to know there though, both poison ivy and poison oak can have more than 3 leaves. So it's not always the best.
Right.
It works sometimes, but not always. Because these types of plants, their forms can vary depending on the species, the local environment, and the season.
So there's an eastern, for example, there's an eastern poison ivy, there's a western poison ivy.
Yes, yeah. So we do have, I have 3 separate slides on all 3 of them to kind of show viewers what these plants may look like. Because the biggest thing to avoid exposure is knowing what to look for. I had mentioned to you before we started recording, as I like go on walks with my dog at this point, anytime I see like a red shiny leaf, I'm like, that looks like poison ivy. So I just, since I've had a reaction in the past, I'm to the point where I just assume everything could potentially be poison ivy, which can be tough, especially if you are in the outdoors hiking and so forth. But so for poison ivy, the first one, there's 3 different images that we have. So the eastern poison ivy, that's typically a hairy rope-like vine with 3 shiny green leaves, and they are all budding from a small stem. And these leaves can turn red in the fall. So like if the summer season, which is where we typically come into contact the most with it, because that's when you are outdoors hiking and gardening. But it's just important to know it can be green, but then as it shifts, they will turn red. Western poison ivy is typically a low shrub with 3 leaves that does not form a climbing vine. And then the western poison ivy, it may have yellow or green flowers and white to green, yellow, or amber berries. So there's 3 different images of that for viewers to kind of see.
And when we're talking eastern, western, are we talking the states?
Yes, yes. So it's very important, like just if you are viewing this and you're not in Massachusetts, look it up and kind of see what your local environment, like what it could look like.
Or if you're from the eastern part of the United States and you are traveling to the western part
Yes.
of the country.
That's important, yes, very important.
Okay, poison oak.
So for our poison oak, so we again have 3 different images of this. So this would typically be a shrub with leaves of 3, similar to our poison ivy. The Pacific poison oak may be vine-like, and it may have yellow or green flowers and clusters of green, yellow, or white berries. The leaves look a little similar to poison ivy, but it's off just a little bit. So again, just make sure you're just being vigilant as you're out walking and so forth.
I was unsure, actually surprised about the flowers and the berries.
Yes, yeah.
Thank you for informing me there. And
Yeah.
then I guess poison sumac.
So our poison sumac, so this looks quite different than our poison ivy and poison oak. So it's a woody shrub that has stems of 7 to 13 leaves, and they're arranged in pairs. And this may have a glossy or pale yellow or even cream colored berries. So with our sumac, that does tend to have berries on these bushes. So again, it's tough to assume everything is poisonous, but when in doubt, you kind of want to just assume it is if you don't know. And it is kind of with like smartphones nowadays. I know there are different apps you can download. Don't know them specifically.
That's a good point.
But there are many different apps like for plant identification. So you could always scan, like take a picture with your phone and like upload it to see what that plant is. So that way, if you do come in like if I go for a hike and I'm like, wow, I found myself really close to this bush today, take a picture and look it up to see if it compares to any of these 3 poisonous plants.
Technology.
I know.
Let's look at treatment.
Yeah, so the biggest thing, you want to rinse the skin immediately. So you can use a rubbing alcohol, a poison plant washes, or a degreasing soap, such as like dishwashing soap, and lots of water. When I talk about like the poisonous plant washes, I know if you go to certain stores, such as like different hardware stores, like Home Depot, Curry Hardware, and so forth, Lowe's, they will have like bars of soap that like will be specific for poisonous plants, because a lot of this is geared towards people who are outside, especially all this information coming from occupational safety. It's really geared towards outdoor workers. But when in doubt, if you don't have like that specific bar of soap at home, you could always use your dish soap. So you want to make sure you're washing it thoroughly with lots of water and rinse often. So this prevents the wash solution from drying on the skin and further spreading that sap oil. And that sap oil in the plants that causes the allergic reaction causes like a contact dermatitis, which is where you see that rash, is all that means, the contact dermatitis. You want to make sure you are scrubbing under your nails with a brush. It can be very painful, of course, if you have poison ivy under your nails.
Right, I never thought about that.
Yeah. Another thing, you can apply wet compresses, calamine lotion, hydrocortisone creams to the skin to help reduce the itching and blistering. Any of those types of medications you may use, follow the directions that are on the label. And you do not want to apply these lotions or creams to broken skin, such as like an open blister. So if it is a very large area and it's blistered and weeping, it's probably time to check in with the doctor just to ensure you don't need further medication. Because I know in the past when I had it on like my lower legs, just from being outside in the woods, and I ended up needing a steroid cream because it was so bad. And it wasn't healing on its own. And you think of it, if you have like an open wound like that, an open skin rash, it's very prone to infection. So you want to make sure you're following up with the healthcare provider if necessary. Another thing people do find relief with as well is like an oatmeal bath. There are many different brands you can find. Typically, if you go to your local like pharmacy store, you can look or ask a pharmacist what would be the best one to use.
That would be soothing for the skin.
Yes, very soothing for the skin, and it helps with the itch relief. Because again, you never want to scratch these areas just for the risk of infection. You could also take like an antihistamine such as Benadryl to help relieve with the itching. Once again, make sure you're following those directions. And it's kind of interesting to know too that this sap oil can remain on objects. I believe it's up to 5 years. So you want to make sure if you were out there with a rake and you touch the sap oil and then you touch the rake, it can live on that rake for up to 5 years. So you want to make sure you're cleaning that object as well.
That's wild, and I'm glad you mentioned that because a while back, I believe it was a health commissioner in Quincy in the past said that there was some kind of a relic that was found somewhere, and it still had the oil on it from the ivy that it touched or that was climbing on this particular stone relic.
Yes, so it's very like you wouldn't think that, but it can remain on that object for years. So just make sure you're cleaning appropriately.
You mentioned Benadryl and I suppose anything that might relieve the itch. Be careful about antihistamines and drowsiness.
Yes, so read the label again on the medication because if it does cause drowsiness, again, it would advise you not to operate machinery or drive. So that's important to follow. It's important to know if you have young children and they get exposed to poison ivy. Make sure you contact their pediatrician just because where they are so young, if it's on their leg and then they're touching the sap oil, then touching their face, that can become an emergency right away.
Right, so adults can, if you tell an adult not to scratch
Yeah.
the area, they likely won't. You tell a child not to scratch, the need to scratch or the want to scratch
Yeah.
sometimes overrides your command.
Yeah, and it's always good, like for an adult, like you can try these home remedies, these over-the-counter medications, like the oatmeal baths, cool compresses, and monitor like for signs of infection or if it's spreading and getting severe. Check in with your doctor. For a child, check in with the doctor anyways, so they're at least aware, and then that way if for any reason that situation escalates or worsens, their doctor's already aware of what's happening.
You had mentioned rash on the face or the genitals.
Yeah, so it becomes a medical emergency if it's on your face or genital areas, especially you think of like your eyes. You want to make sure that you are calling a doctor in any of those circumstances. Even if I had it like on my forehead, I would call my doctor because that can quickly spread to your eyes. And there's also, especially when we think of like our outdoor workers, we'll see with like sometimes like if, let's say you're a firefighter and there's an outdoor fire and there's poisonous plants burning, if you're inhaling that, it can also be very severe. So you'd want to call 911 or go to an emergency room as soon as possible if you're having a severe allergic reaction with swelling or difficulty breathing, or if you've had a severe reaction in the past. So make sure you follow up. Like if you had it very severe when you were younger, or if you were around plants burning and you think you inhaled, go to the emergency room as soon as possible.
It always surprised me that goats aren't bothered by poison ivy. Matter of fact, a lot of times they chew the poison ivy to kind of keep an area, or they're used as a not a precaution, but as a, I suppose, as a trimming and as a relief to an area to get that poison ivy out.
Amazing. I did not know that fact. Yeah,
And
that's
it must not
amazing.
itch because they
Yeah.
swallow the leaves. But
Very
they're not us,
interesting.
so clearly we are different. All right,
Yeah.
let's look at ways to protect ourselves.
Yeah, so again, where this information came from, the occupational safety, it's geared towards outdoor workers, but this is anybody who's outside, who enjoys the outdoors, whether you're hiking, working, gardening, ways you can protect yourself. So
I do all those things, by the way.
yeah. You want to wear your long sleeves, long pants, boots, and gloves.
Which is tough in the heat of the summer.
It is very hard. But you want to make sure, like, if you know especially if you know, like, if I'm working in my backyard and I know there's poison ivy, put gloves and long sleeves on. Stay hydrated, of course, especially if it's hot. But make sure you're aware of your surroundings. You want to make sure you're washing exposed clothing separately in hot water with detergent. So if I was out back gardening with my long sleeves and gloves on and I knew there was poison ivy, I'm not going to throw in that shirt and gloves into the washing machine with my other clothing.
And a lot of people will do wash on cold only. In this case, you want to do a separate wash with the potentially contaminated clothing in hot water.
Yes, the best way to eliminate that sap oil. There are also barrier skin creams. There's a lotion that contains bentoquantum, which can offer you some protection before contact. And this barrier creams that would contain that should be washed off and reapplied twice a day. And that's more, again, if I've had severe reactions, I know I'm about to deal with poison ivy. But typically I would try to go more the route of like the long clothing if possible. We had mentioned that this sap oil can survive on objects for up to 5 years following exposure. After using tools, make sure you're cleaning them with rubbing alcohol or soap and lots of water. And you want to make sure you're wearing disposable gloves while you're doing this, because again, it's going to go right from the object to your skin. So that's a big important thing, to make sure you're wearing gloves and protecting yourself. And then just to get back on the burning plants, you do not want to burn plants that may be poisonous. So if you think it's poison ivy, oak, or sumac, don't burn it.
Which may, for folks, they may think that that's an appropriate solution, but in fact, then that becomes airborne.
It becomes airborne, and if you inhale that oil, it can lead to like severe allergic respiratory reactions, and that would be an emergency that would require 911 to be called, or at least go into the emergency room as soon as possible. So you really want to just make sure you're keeping yourself safe. Look up what I know we showed some images of what these look like, but make sure you know in your specific area where you are, or you mentioned if you're traveling, especially like we love hiking to like national parks and so forth. Know what to expect in the area you're going to fully protect yourself and hopefully avoid any reaction.
Very good. And as we end this particular episode, let's talk about resources.
Yes, so I mentioned a couple times, but if you go to the National Institute for Occupational Safety and Health, so this is through like the Center for Disease Control and Prevention, so it's a government website. And basically these regulations are for outdoor workers, but again, it applies to anybody who's outside, especially in these spring, summer months, fall months when people are outside exploring, gardening. You want to really make sure you're keeping yourself safe and visit this website for further information. It's a wealth of knowledge. And any of these websites, when you go to it, there are endless links to click on for additional information. There's only so much we can cover in such a short time.
And we mentioned this in other programs as well. Don't self-diagnose, especially if you see the condition getting worse. Certainly contact your physician.
Yes. And there are a lot of people who chronically may get poison ivy and they know how to treat it at home. So if you are an adult and you can do these home remedies, that's great, but you want to make sure you're keeping an eye out for an infection. And if the severity increases, or again, it's on your face or your genital areas, make sure you're seeing a doctor, because it can get to the point where you might need like a steroid to help your body heal the rash.
All right, very good. I believe you covered poisonous plants quite well. Good job.
Great, thank you so much.
Thank you. And thank you at home for watching. And just please remember to support local access television, local access media centers in the community in which you reside. Again, the community access provides programs just like this, so keep them coming. Stay healthy. Take care.